Yes, this is Dr. Mursalin. I'm the Chief Executive Officer of Park One and really, it's a pleasure for me to give an update on the current situation of the deployment of One Health EBS platform in Pakistan, which we developed in close coordination and technical supervision of ending pandemics Pakistan. So this project was launched during 2021 to May 23. So I will just give you some brief on that. You see. The main objective of the project was to create an integrated platform where the information from multiple One Health sectors could be captured and collated for joint decision making. So the other objectives were to develop some smart solutions or ICT smart solutions for joint action and across multiple, because this was the project of its own kind, where for the first time the MIS systems of multiple sectors were being an effort was being to link this for joint decision making. And the other important objective was to develop some training material so that the concept of this One Health approach would be more and more promoted, and some manuals are created which could be regularly used. And so to start with, we started with the development of these manuals, and this project was not run by a single organization. Park Owners was the facilitating body, facilitating organization, where there were implementing partners and coordinating partners. So with implementing, we had the Ministry of Health, Government of Punjab, UHS, the Livestock Department. Coordinating, we had academia, National Institute of Health, National Institute of Agriculture, and the Center and Ending Pandemic itself. So initially, we developed a training program so that some representatives from these sectors could be oriented and trained in the concept of One Health, and they should be willing to take it. And based on that, you see that some training workshops were organized in Lahore at the Punjab level and at federal level, and and where the representatives from multiple sectors were invited for this training and this kind of discussion, where these manuals were applied. You see. So the basis of whole this exercise platform was to work on the epidemic intelligence, which means the early detection of public health events in multiple sectors, its verification, the risk assessment, and the risk communication among the sector, among the public, among the decision makers, so that the earlier actions could be taken. So the dashboard was developed. Certainly the objective we have already explained. The target of this dashboard is to start with is not the general public but the decision makers in these sectors. To start, as I said, that initially it was decided that let us create a link between the MIS of livestock sector and the health sector, the public health, the animal health side. In later stage, this could be expanded to environment and to the food sector. So they were the audience, and it was implemented stages and stage wise, and system development was done through a wider consultative process. So this is the conceptual framework where the MIS of various departments, there was a contact, and ultimately the information was to be selected information on priority diseases, which was decided earlier, was to be transformed to the dashboard for joint decision making. So to simplifying this, the MIS systems of both the health sector and the livestock sector were consulted, and you see the One Health information on 13 priority problems which were agreed was extracted and analyzed for joint decision making process. So but at the same time, we were really concerned that the indicator based MIS system or surveillance systems we can work, but there is a big gap as far as the event based surveillance system is concerned, and this is being already implemented in other countries, and we had a collaboration or contact with other like Bangladesh, like Cambodia, Albania, to know more about how they are implementing the event based surveillance program in the country. So there are like multiple MIS systems already operating in health and the animal sectors, and this is DHA is very popular in the health sector, where it has a dashboard, is gathering information from all over the province and the country, and this could be, and it creates alerts, and it has definitions and indicators. And then there's a disease surveillance program in Punjab, the biggest province of the country, is also working particularly in the teaching hospitals. So you see, it is also capturing a lot of useful information which could be utilized. The animal disease surveillance program is being developed by livestock department in Punjab particularly. It is not as well established as the MIS systems of health sector, but it has 3 applications, one for the farmers, one for the vets, and other for the senior district level veterinarians. And it is capturing information, but certainly a lot of work is yet to be done in this context. But it is capturing real-time information. It has GPS location of the animals having these problems, and it is also capturing information from the laboratories. So this is the home page of our dashboard, where information from multiple MISs, indicator services is being collated on one page to make, when we can make a comparison. We can look at the, for example, the dengue being depicted in DHIS2, IDSR, or for example, other priority health problems, the rabies being depicted in dog bite cases, being depicted in livestock MIS system, the surveillance system, and also in the government DHIS2 and other systems, and make a comparison, and we can look at and pinpoint the places where all this is concentrated. So this is again there. So there were 2 parts of the priority disease list, and this list was selected through long consultative process, where you see the One Health priority disease and some other. So it is like 13 diseases on which the information from these multiple sectors being captured and depicted on this dashboard. So this is the map representation of this same information. And now coming to the event-based surveillance, you see the event-based surveillance information. This is something which was not available, and we had to start from scratch here. You see, and we wanted to get our own capacity built, and thanks to ending pandemic and experts ending pandemics who have been working with us on this, and we were then able to start with. We created an event-based surveillance program based on the information from media, media, electronic media, print media, and multiple data sources, and depict on this. So now it is the time to make a comparison between the two. So this is a quick introduction. Certainly for the way forward, we need to continue capturing the real-time information. We need to consolidate the work that we have done in the pilot phase. We still need to develop some very explicit SOPs, mechanism intersectoral coordination. We need to set the stage for evidence-based decision making, sustainability plan, and certainly the use of artificial intelligence, enhanced use of artificial intelligence or epidemic intelligence to make this exercise, to bring this exercise to a logical conclusion. So this is like the work in progress, and we need to still continue working in this conclusion. So thank you very much.